Hi, my name is Tyler Swearingen, and my final presentation is on schizophrenia. So, what is schizophrenia? Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with the reality. Schizophrenia is typically diagnosed in the late teen years to the early 30s and tends to emerge earlier in males rather than in females. Schizophrenia can occur in younger children, but it is rare for it to occur before late adolescence. So, what are some symptoms of schizophrenia? The symptoms of schizophrenia generally fall into the following three categories: psychotic symptoms, negative symptoms, and cognitive symptoms. So, psychotic symptoms are things such as hallucinations, hearing voices, or paranoia, or irrational fears, and disorganized speech. So, when someone's suffering from these symptoms, they sometimes feel like they're seeing things or they're hearing people talk about hurting them, and many times they, like when they're watching TV, they'll think that there's a message being played specifically for them from the TV. And then negative symptoms are loss of motivation, depression, little to no facial expressions, and almost no communication. So when they suffer from these symptoms, they basically are just depressed all the time. They never want to talk or interact with anyone and just be left by themselves. And then the cognitive symptoms are difficulties in making decisions, forgetting information almost immediately after they are told or learned it, and trouble paying attention. So, schizophrenia risk factors. Schizophrenia sometimes runs in families. However, it is important to know that just because someone in a family has schizophrenia does not mean you will get it. So, it is known that schizophrenia is passed down by genetics, but just because someone in your family has it does not necessarily mean that you will attract it as well. It is not yet possible to use genetic information to determine who will get schizophrenia due to the fact that there is no single gene that causes the disorder. So scientists are still trying to figure out exactly how they can predict who will attract this gene. Scientists believe environmental factors such as poverty, nutritional problems, or stressful surroundings could lead to schizophrenia. Scientists also believe brain structure, function, and interactions among neurotransmitters can develop schizophrenia as well. Because schizophrenia is such an interesting condition and we still don't really know much about it, I decided to kind of dive into the history of it a little bit. Schizophrenia has been around for as long as people have. There have been references in the Bible and classical writings that can attest to this. An example of this is in Mark 5. There is a story of a man called Gerasene the Demoniac and how he would howl all day and night and bash himself with stones. Though obviously it was never said that he was a schizophrenic, it just portrays that he was showing symptoms of this, so people believe that he was suffering from schizophrenia. And the earliest reference of schizophrenia dates all the way back to 1550 BC in Egypt. So just some more history on schizophrenia. Dr. Emil Kraepelin was director of the psychiatric clinic at the university in Estonia. He was the first person to come up with the concept of schizophrenia back in the 19th century. He first called it dementia praecox, or premature dementia, and he believed that the condition always had a steadily worsening course, or if there was any improvement at all over time, it would not be very significant. Once people started to understand more about schizophrenia, asylums started to be created for them. At the time they were built, they were seen as compassionate, alternative ways to confining lunatics in prison or to life on the streets. But however, unfortunately, later on, many asylums were found to be very abusive and unsupportive to those suffering from schizophrenia. So ultimately, these asylums ended up doing more harm than good. Some more recent history on schizophrenia is that during the 1930s, Nazi Germany did much research on schizophrenia, trying to figure out as much as they can. Having determined that this condition is incurable and causes disturbing and lunatic behavior, they decided to euthanize all those with schizophrenia. They came to this conclusion because they knew that schizophrenia is passed genetically, and since you cannot tell who is going to attract it, they decided to just euthanize everyone that has this condition so later on they will not have to deal with anyone suffering from this condition. In 1983, however, a Mental Health Act was passed that introduced regulations in hospitals for those with schizophrenia. So as I said before, when asylums started opening up that were specifically made for people with schizophrenia, but it turns out that they ended up being really abusive and doing more harm than good. This act was specifically created so that hospitals can open up and they will be regulated so that people suffering from this horrible condition can get the attention and the resources that they need. And today, although there's still much research that is needed to be done, 25% of everyone that is infected or shows signs of schizophrenia will fully recover, and then the other 25% will substantially improve due to new medications. So, how to treat schizophrenia? Due to the fact that schizophrenia is complex and not fully understood yet, treatments mainly focus on managing symptoms and solving day-to-day problems. So since there's still much research to be done, these treatments don't necessarily cure schizophrenia. They're mainly just trying to help people cope with it day by day and learning to live with this condition. So one of the treatments is medication, and this can help reduce the intensity and frequency of episodes. So they typically medicate patients so that their episodes aren't as scary or as trembling, and that these episodes do not happen as frequently as they would without medication. Another treatment is cognitive behavioral therapy. This therapy can help treat the cognitive and negative symptoms those with schizophrenia have to face. So this will help with them, how earlier when I said that they were depressed all the time or that they had trouble remembering things, this therapy helps them overcome those obstacles. And another treatment is just basically having family members and friends learn about schizophrenia and take the time to support those suffering from the condition, and this can help them with the stress that they face every day. So just something as simple as parents or friends or even children just taking the time to learn about schizophrenia, and that way that they could just help whoever it is in their family or in their friend group that's suffering from this to just not have to be as stressful, and just like calm them down every day. Just the fact that they know someone's there and willing to take the time and help them through this condition. And these are just the sources that I used to help find the information for this presentation. So thank you guys for listening to my presentation on schizophrenia, and I hope that you guys learned some things and it kind of got your eyes open a little bit to this condition.